Dr. Iqbal, you brought up some great points talking about the low blood pressure. And elderly men have a tendency then also to have problems with hypertension or high blood pressure. They may already be on medications, and then adding this medication, you talked about the side effect of the low blood pressure. So they need to come to you ready as they're coming in and getting that history with all their medications that they're already on, correct, to see what best suits them.
Absolutely. We always look at the drugs the person is taking, and then we can advise them what drug to take and what to stop. Most of the time we send them back to their cardiologist, internist, and family physician so they can go ahead and adjust the medications. And also with benign prostatic hyperplasia symptoms, patients have erectile dysfunction. So we have these drugs, PDE5 phosphodiesterase inhibitors like Viagra, Levitra, and Cialis, and that also reduces the blood pressure. So they have to be very cautious about using these drugs. Usually what we advise them to take these alpha blockers, like maybe at nighttime, and then a PDE5 inhibitor sometimes later on after 4 or 5 hours or in the morning. But these PDE5 inhibitors like Cialis is now approved for treating BPH because there is some way that also open the channels of the prostate gland.
Dr. Iqbal, we've been talking about BPH and how important it is for men to partner with their healthcare professional. They're going to look at their signs and symptoms, a little bit of their history, what's been going on, maybe in their lifestyle, and then also the medications that they're on. Then they would look at maybe having that medical treatment, starting on some medications that are out there and new ones that are out to help them out, and then also surgical options. And when we look at the surgical options, I know that there's something out there called PVP. And is that the same thing as the green light procedure?
Yes, ma'am, it's the same.
Okay.
It's photoselective evaporation of the prostate. It's KTP laser 532 nanometer. It's a very exciting operation. Patient does not have to stay in the hospital. They're there only for less than 24 hours. You can send them home with a catheter, sometimes without the catheter. You don't have to use continuous bladder irrigation anymore. You don't have to worry about bringing the patient back to the operating room to relieve them from blood clots, which we used to have with the TUR prostate, which was the old operation we used to do. And they're trying to do some remodeling of the operation where we can spare the apex of the prostate so the patient may still be able to ejaculate a little bit, because that's one of the side effects of any operations we do on the prostate is retrograde ejaculation or no ejaculation coming out at the time of climax. And it's sometimes hard for young people to take that. So with modification,
that's what I was going to ask.
Also.
So the new green light is less minimally, I guess, side effect as far as erectile dysfunction. Is that correct?
Yes.
So
yes.
A lot of people obviously would want to look at that option for their lifestyle, and then less, I guess, maybe recovery time for the patient too. Is that correct?
That's much better. They can go and start doing some of the stuff after about a week or 10 days. I still tell them not to do any straining exercise or sexual activities for 6 weeks because prostate is so bloody. I don't want them to start bleeding. And but it's a much better operation than we used to have, which was TUR prostate. And we end up with the same thing. It's a nice crater we make inside the prostate, and it's wide open.
Are you seeing any patients that might have had that surgery before the TUR prostate? Is that what you had said? Are they looking to then maybe have the green light, or if they've had that TUR prostate, they cannot look at the green light too?
So, most of the time when you do a good TUR prostate, the prostate is wide open. Sometimes it takes them 20 years to have any regrowth of tissue. But it's very easy. You can use it on anybody. It's just like a laser. All you have to do is open up. And I'd like to mention that there are some other minimally invasive surgeries which we can do in the office, which is radio frequency of the prostate is called tuna, and microwave of the prostate, and also interstitial prostate with the lasers. We can treat that, but they're not predictable like green light laser or PBP we discussed about. And there's something new on the horizon is now we can use Botox in the prostate. It's not approved yet, but they're experimenting with injecting Botox 100 units to 300 units in the prostate gland, and they have shown that it does relieve the symptoms and also reduces the size of the prostate at the same time. So that might be something in the horizon coming out.
A lot of new advancements then for something that is very common, and I hope we've encouraged our viewers today that if they have some of these signs and symptoms to look and talk to their healthcare professional, because there's a lot of things that are out there to take care of it.
Yeah, exactly, because there are almost like 12 million men over 50, and we only see about maybe 2 million people. So there are about 10 million people don't even come for the treatment.
Right. They're walking around with these signs and symptoms, and as you said too, don't want to discuss it with anyone.
Exactly.
So don't be afraid to open up and then maybe be able to enjoy life a little bit more by having some of these medical treatments and or surgical treatments too. Now you said earlier, I know, starting around age 35, the prostate tends to grow, right, more rapidly. Is that, did I understand that correctly? So how would somebody know in the distinction between maybe BPH and then of course prostate cancer? They're not the same, but they need to be screened, and there's something called prostate screening. So would this be something that they need to start looking at, and about what age bracket is that?
It's, I'm a urologist, so I am very much in favor of screening of prostate gland for prostate cancer. And PSA came out like around about 1988. There's a lot of controversy about it. Most of the time, the non-urologists think that it should not be done, but it's very important as far as I'm concerned. I'm lucky to be in practice before PSA and after PSA, and the number of bad cases of prostate cancer with bony metastasis have suddenly reduced tremendously. So basically, if the patient has a prostate cancer in the family, they need to have it screened at 40, at least have a PSA done, rectal examination, and then every 3 years till they're 50.
And the PSA is lab work. I didn't mean to interrupt.
PSA is just a blood test.
Right.
And then for African Americans, they have a higher incidence of prostate carcinoma and a bad disease. They need to start doing at 40. And then maybe every year have a PSA, or at least every 3 years PSA.
So two parts, the lab work and then also the digital
rectal examination is very important.
To do both. And so really you need to talk again to your healthcare professional about your personal risk factors, your family history, and see when you need to be screened for prostate screening. And this is also a time where you may find out if your prostate's enlarged and may look at further diagnosing than of the BPH, correct?
Exactly.
So great information you've shared with us today, Dr. Iqbal, and we hope we encourage the male viewers, and or if you're a significant other or a family member, encouraging dad, brother, somebody to talk to their healthcare professional about some of the issues that may be going on with this urological condition. So thank you again, Dr. Iqbal, for being here.
Anytime, and actually it's such a extensive field that we have really just barely scratched the surface. If you go into detail, it'll take you about a week before you get over the whole information.
Absolutely, and today we just spoke about, you're right, just one specific common problem, and that's the BPH for males. So if you're needing more information, we encourage you to go to our website at Heartland Memorial Hospital at www.hmh.net and click on HealthLink. We hope you tune in next month for another important edition of Health in the Heartland.